Hello everyone, I'm Adrian Dix, I'm BC's Minister of Health. I'm joined today by Dr. Bonnie Henry, BC's Provincial Health Officer. I want to recognize we're on the territory of the Lekwungen-speaking people here of the Sanghees and the Esquimalt First Nations. We're honored to be here on their lands. Before we start our presentation today, I'd like to acknowledge the extraordinary wildfire challenges occurring throughout the province and in Alberta. And this is particularly important in healthcare. Wildfires have resulted in care home evacuations of 20 care home residents from New Denver, care home residents from Williams Lake, care home residents from Ashcroft, and some patients from Fort St. James who required evacuations to safer locations. And of course, our thoughts are for everyone in our neighbors in Alberta and Jasper. As their community is devastated by wildfire. This is a significant issue. I want to acknowledge all of the work of all of the people fighting the fires, all of the communities involved, and all of the healthcare workers involved. All of you will know last year, but 1,000 care home residents had to move because of wildfire, and it is some of the most extraordinary work that health authorities, but healthcare workers have ever done in supporting people in those very challenging circumstances. With that, it's my honor to introduce BC's Provincial Health Officer, Dr. Bonnie Henry, and invite her to the podium. Dr. Henry.
Good morning, and thank you, Minister. Thank you, everyone. I also want to address my thoughts and prayers to the people who are dealing with the wildfires that are affecting communities across British Columbia. And our hearts are also with our friends from Jasper, and we know it's a special place for so many people across Canada, and we're thinking about them today. But as the Minister had indicated, today is indeed a very special day. We have been through so much over the last 4 years, on top of these summers of wildfires and smoke and flooding and drought and all of the other challenges that we face together. But the COVID-19 pandemic has affected us all and changed so much in the world. As I know many of you are aware, as part of the role of Provincial Health Officer outlined in the Public Health Act, I have the responsibility to protect the health of the public, and that includes declaring a provincial public health emergency on 17th of March 2020 when COVID, or SARS-CoV-2, started making its way on the global stage. There are certain criteria under the Public Health Act that an event is unexpected, could have serious impact on public health, that there's significant risk to spread of an infectious or hazardous agent, and there's risk to travel, trade, and to health in the population. We have reached the point in this journey that we've been on where I am confident that we can now lift the requirements of a public health emergency. So effective immediately today, July 26, we will be ending the public health emergency for COVID-19 and be rescinding the few related orders that are still in place. And that includes rescinding the PHO order requiring COVID vaccination to work in our healthcare system. As you know, this is an important part of my responsibility to review the need for orders regularly to see if the conditions are continue to be met and remain. And after a careful review of the data, our epidemiologic indicators, the state of our healthcare system, the situation in BC, I am confident there's no longer a need for this public health emergency and the powers that come under that to remain in place. So just to be clear, I look at a whole variety of things from testing, infection rates, outbreaks, people in hospital, the numbers of people in ICU, deaths, immunization rates. We look at the vulnerability in certain populations, particularly people who are more likely to have severe disease from COVID-19. And we look at the evolution of the virus, and that's one thing that we've been really following closely, that whole genome sequencing, the changes in the virus over time. And what is happening in other places. And as we know, there's been some uncertainty over the last number of years, particularly during respiratory virus season. We saw last year and again this year there was a bit of a spring increase, and so I've been watching that carefully, watching what's happening. We know in the United States there's been a particular resurgence of COVID, including President Biden, as many people know, and in many places in Canada. And over the last few months, we've also seen an increase in things like the wastewater monitoring that we're doing, increase in hospitalizations. But in the past couple of weeks, that has started to come down. For the last week, we've had less than 200 people in hospital with a positive COVID test. I think yesterday it was 164. And the number of people requiring ICU care has been relatively steady over the last few months, and yesterday it was 11 people that we know. We know that Omicron is still the predominant strain that is circulating, and we've been following the evolution of Omicron, and it has not changed as quickly as what we were seeing in the early times of this pandemic, when there were major shifts in different strains of the virus. And we were just talking about how in the winter of 2021, and when Delta really devastated our healthcare system just as vaccine was coming available. So the whole genome sequencing that we've been doing and following through the BC CDC has shown us that it is a relatively stable variant of Omicron, the JN1 particularly, and it's of related strains that are circulating now. There was some concern when that strain first emerged that there were enough mutations that it might be able to evade the protection from vaccination. But in the last week, there have been a number of studies that have shown that we are still getting good, strong protection against severe illness from the vaccines that we had in place here, the XBB vaccines that were in place in the fall of this year. And so that is all of the types of information that I take into consideration. We had this, as I mentioned, concern about a spring rise, but it has leveled off, and this vaccine effectiveness and vaccine protection, particularly from hybrid immunity, is very important in how we mitigate the effects. And in BC, we've seen that be very effective. And I think we can attribute some of that to the very high rates of vaccination in our healthcare settings and in the populations across British Columbia. So just to say that, COVID is still with us, and it is going to be for the foreseeable future, and it will change. And we will be monitoring and continue to monitor the changes in the virus itself, and it may be that we will need to impose different restrictions over time. We know it's inevitably going to mutate, and it will likely surge again in the fall, and we'll be talking about the importance of vaccination as we head into our respiratory season again this year. And it may be that we'll need to have different varieties of the vaccine over time. But we also know that we have processes in place in our healthcare system now, that healthcare workers, we have such a high level of protection rate now that we know how to use the other measures like staying home when we're sick, cleaning our hands regularly, wearing masks when needed, covering our coughs. Those are all the things that we all can do, and we need to remember those as much as I think many of us would like to be able to forget them and put them behind us. While COVID-19 is not gone, we do have higher levels of protection within our healthcare system, as I said, and in our communities. And if we look at the other places across Canada and across North America, these high rates of protection from vaccination and from that hybrid immunity have made a tremendous difference across British Columbia. I will continue to monitor, along with the BC CDC, all of the indicators that help us understand what's happening with all of the respiratory viruses that we are facing. But for now, the data tell us we no longer need the order for mandatory vaccination of healthcare workers. And like when we lifted the other multiple orders that had been in place, they were rescinded when they were no longer necessary. And that's part of the role that we play. We've adapted to the changing situations and responded to what we see in the data. And we're in a place now, I believe, in this journey where we no longer need these orders in place. It has been a time of great uncertainty for the last 4 years, and for many, a time of fear and anxiety as things have changed, sometimes very rapidly. And I know for some people, this removing of the last of the PHO orders will increase their fear and anxiety. And we've seen some of that play out in the media and people's concerns that there is still this virus causing illness in our communities. But for others, it will be very welcome. We've also seen through this pandemic just how important vaccines and immunity are. Vaccines and the vaccines for COVID-19 are no exception, have saved countless lives in our communities, our families, our country. Protecting those especially who we know were more at risk of having severe illness and dying from this virus, and that, of course, is our seniors, our elders, and people who are immune compromised. We have, I believe, a renewed understanding of the importance of vaccines for keeping people safe, and particularly the role that we have in ensuring that we are protected from vaccine-preventable diseases in our healthcare system. I am incredibly grateful for everybody in BC who rose to the occasion over this last period of time and did their best to support each other through these most challenging days with kindness and with compassion. Let's keep that in our minds and in our hearts as we face the ongoing challenges of climate change with wildfires, the toxic drug crisis that continues to take the lives of our families and our community members, and with every new threat that we face in our community. I'm going to turn it over to Minister Dix.
Thank you very much, Dr. Henry, and I think this has been an extraordinary period. The period started, of course, before the declaration of the public health emergency on March 17th, 2020, which ends today on July 26th, 2024. But the contributions of people, and I'll come back to this later, the contributions of the people of BC, the healthcare workers of BC, the people of public health, have been exceptional. And it's the reason, in short, why BC has had the best response to COVID-19 in North America, was because of everyone working together and the generosity that everyone has shown to one another in very difficult times. And we recall, and Dr. Henry has evoked what some of those times were, the periods around the time of the declaration of the public health emergency, when we saw the video and the images from Italy and other jurisdictions, and we're preparing for dealing with that here. The time in the fall of 2021 when we were dealing with the Delta variant of concern, and people who were not vaccinated, who chose not to be vaccinated, in very large numbers were getting very sick in intensive care in our province. Many of them, hundreds of them, had to be flown from the north and the interior to the south and Vancouver Island to get care, and that the care that they provided was exceptional. And just all the losses that happened to people, big losses and small losses. And I just wanted to acknowledge that, acknowledge the significance of that moment, and we will, I'm sure, have opportunities, many opportunities in future to reflect on that. With the official end of COVID-19 as a public health emergency, the BC vaccination mandate order is lifted. The lifting of PHO orders has significant and important meaning. The mandate was instrumental in protecting healthcare workers against severe COVID-19 illness and complications, reducing the transmission to vulnerable patients and care home residents, and supporting the resiliency of our healthcare system. It demonstrated our determination to support and protect people, ordinary people, vulnerable people during a pandemic, and to protect healthcare workers. And that view, that strong support for public health was reflected in the response that healthcare workers had across the country to what we did in British Columbia. We led the country subsequent to the vaccine mandate coming into place in the recruitment of nurses, in the recruitment of doctors, in the recruitment of health sciences professionals, in the recruitment of healthcare workers. In short, we have, because we are committed to the important clinical and independent role of healthcare professionals and supported them from the provincial health officers to doctors to everyone else. We, I think, supported our public healthcare system in extraordinarily difficult times. It was the right decision then, and I'm very proud of all the people that put it into place. What the question is, of course, what do we do at this point? We must take action in BC to ensure that we maintain high immunity rate against COVID-19 influenza and other vaccine-preventable diseases among healthcare workers, giving them the best protection to them and those in their care. Therefore, today, by ministerial order, I'm directing immediate action on the following. First, I'm directing a policy requiring health authorities, including the Provincial Health Services Authority and Province Healthcare, to collect, review, and store the immune status of all clinical and non-clinical healthcare workers employed, contracted by, and appointed by authorities for all high-priority pathogens of relevance to healthcare workers, as outlined in the BC Centre for Disease Control Immunization Manual. Those include COVID-19, influenza, but also measles, mumps, rubella, hepatitis B, pertussin, and of course, and I believe I mentioned influenza. And Dr. Henry will be going through in detail that list and the names on that list after I finish here, and the diseases on that list after I finish here. Secondly, I'm bringing forward to Cabinet approval of a provincial regulation. I will be bringing forward to Cabinet after work has been done, a provincial regulation requiring the reporting and collection of immune status records for all high-priority pathogens of relevance to health workers, as outlined in the BC Centre for Disease Control's Immunization Manual. As of July 26, 2024, healthcare workers in the Health Authority owned, operated, and contracted facilities, including doctors, nurses, allied health professionals, and contractors employed or privileged by health authorities, will be required to report their vaccination status for COVID-19 and influenza and their immunity to measles, mumps, rubella, hepatitis B, pertussis, varicella, commonly known as chickenpox. Collecting information about immunization and immune status will occur through a new and improved provincial registry and will ensure reporting is consistent throughout British Columbia. The requirement to report will be phased in, beginning with the immediate collection of immune status records of all new hires and appointees. Healthcare workers terminated due to noncompliance with previous orders can apply for available positions and be hired. These healthcare workers will be required to provide information about their immune status to all the relevant vaccine-preventable diseases. Under the revised BC CDC Immunization Manual, immunization is not required to work in a healthcare setting. In the event of an outbreak, exposure, or future pandemic, healthcare workers who are not immunized, immune, may be required to follow appropriate measures, which could include masking, modified duties, or exclusion from work. Any individual who has become eligible for work is free to apply for employment. There is currently work underway between the government and the unions regarding these issues, as such as recognition of previous service or seniority entitlements. Through the new and improved reporting process, health authority employers will be able to regularly connect with healthcare workers, including contractors employed by health authorities, to ensure their immunization is up to date. As part of this, the province will offer them the immunizations they need to ensure their health and that of their patients. Reporting immunization status aligns with healthcare workers' ethical and moral duties to take science-based measures such as immunization to reduce the risk of harm to those under their care. We know that immunization and immunity is the best tool we have to prevent diseases such as COVID-19, measles, and other vaccine-preventable diseases. The intention of this registry is to protect people, to ensure that the healthcare system can best respond to challenges in the future, and to increase rates of vaccinations across categories quickly and efficiently. This was similar to measures we took in public education and in public and private education in 2019. So in summary, starting today, healthcare workers are required to have their immune status on file with their employer. In most cases, an individual's immune status is already recorded in the BC Public Health Information System and Provincial Immunization Registry. For those individuals, no additional action is required. For those whose information is not up to date, employers will reach out to them to ensure that they provide vaccination records or documents from a past disease exposure. While immunization will not be a requirement of employment, in the event of an outbreak, as noted, healthcare workers who are not immunized may be the subject of other action to ensure the safety of them first, their coworkers, and patients. You recall, and so with that, I'd just like to say just a few things. Finally, this is a significant moment. The COVID-19 pandemic has profoundly affected our province in every way. And I want to say, as I said at the beginning, how thankful I am to the people of BC for the role they played in this. This could not happen without them. The highest vaccination rates. This past fall, twice the level of vaccination as the province of Ontario, twice the level of vaccination in BC. That is a commitment of people in every part of the province who stepped up. Of the 245,000 healthcare workers in BC who every day stepped up, and I think of all of them, of the people in March 2020 who worked and cleaned hospitals and provided food in hospitals, who had their rights significantly attacked over time, but who showed up every day for work. I am honored. I am honored by their contribution to our healthcare system and to their fellow people in BC, to our doctors and our nurses, our public health professionals. I just say a deep sense of gratitude that I have, that the people of BC should have in this moment for the work that they do every day, then and now. BC has a growing healthcare system. We've led Canada in the recruitment of doctors during COVID-19, led Canada in the recruitment of nurses, led Canada in the recruitment of health sciences professionals, and we need more. And every day we are working to improve the public healthcare system, to do with the public healthcare system, in addition to doing all the things it did every day, including dealing with the public health emergency that is the overdose crisis, who took on this public health emergency around COVID-19 and did the best work in North America. I think the facts demonstrate that is beyond question. Finally, I want to thank everyone in public health, and I just want to note two exceptional people. First, our Deputy Minister, Steve Brown, who in many ways led people with confidence and determination and brilliance and generosity. His personal way is exceptional. He is a true leader, a great British Columbian, and I want to acknowledge his exceptional and central role in dealing with these issues, including the work we're doing now in dealing with these new phases of COVID-19 and of public health. And of course, to Dr. Bonnie Henry and her team. There is not a visit to a grocery store that I have in BC, whether it's Save On Marine Way, or Safeway at Kingsway in Tyne, or the 7-Eleven that I go to occasionally get a hot dog along 33rd near Knight, when someone doesn't come up to me and ask me to pass on what they think of Dr. Henry, how much her words meant to them in a moment that was difficult in their lives, how the work of people in public health and how it helped them and supported them in difficult times, how they waited to hear what she had to say at their briefings. And I think that is the best testimony. Dr. Henry is a brilliant scientist, a brilliant doctor, and a generous person, but she's also someone whose empathy for people helped lead us through this pandemic. I was honored, and I have been honored to work with her, as I continue to do, and it's now my honor to have her return to the podium to say a few things about the detail of the mandatory registration system for immunization.
Thank you. And after that, I will be brief. I think people have heard, perhaps from me, quite a lot. So while the vaccine mandate for COVID-19 is now ended, as we've mentioned before, we've learned so much about the importance of knowing the risk of vaccine-preventable diseases, particularly in our healthcare setting. So this new requirement to report both the immunization or immune status, depending on the vaccine-preventable disease, for these critical vaccine-preventable diseases is an important step to keep our rates high and continue protection of healthcare workers, our public health care system, and the patients and residents that we care for every day. We know there has been a global increase in many of these vaccine-preventable diseases over the course of the pandemic because of interrupted immunization programs in many other countries, and we're particularly concerned about measles. Measles has been spreading in many places, and measles we have a highly effective vaccine that we've known for a long time. So having this mandatory reporting requirement for all of our healthcare workers is a way of ensuring that we have those high levels of immunity that we need. It's finding a balance between the emergency requirements that we needed when at a time when people were very vulnerable to a new virus, and being able to effectively respond to the increasing and changing global picture with these vaccine-preventable diseases. These are the ones that cause serious outbreaks or serious illness in healthcare settings, and they're ones that we have been working on for a long time to ensure that healthcare workers have protection for themselves, and also so that we can manage exposure events and outbreaks effectively and efficiently. So we know that people who are not immune to some of these pathogens, things like measles, very often it's because they just haven't got around to getting their vaccine updated, or they didn't realize that they were due for another dose of vaccines. So what has happened in the past, and we've had examples of this in 2011 with a very serious and severe measles outbreak, in 2014 when we had very high pertussis outbreaks in communities around this province, is that we've had to exclude healthcare workers until we had an understanding of their immune status, and that often meant having lab tests or trying to dig up records that your mother may still have or not. So that made it very inefficient and time-consuming, and it meant that healthcare workers needed to be off work because we didn't know if they were going to develop this disease and potentially pass it on to others before they were sick themselves. And that's particularly an issue with measles, which is such a highly contagious and infectious disease. So this requirement will mean that we have a provincial level understanding of the immune status of our healthcare system for all of these important diseases, and as mentioned, will require reporting of immunization against COVID and influenza, because those are ones that we have on a routine basis, a regular basis, knowing what people's, how many people have protection against those changing viruses. And we call it immune status for a number of others. So measles, mumps, rubella, varicella, which is chickenpox, hepatitis B, and pertussis or whooping cough. And immune status, we call it that because for many of us who were born before 1970, we have been exposed to things like measles, and we have immunity from previous infection. And for many of us in medical school or when we get jobs, we have to show proof of that immunity. And as the minister mentioned, there has been policies in each health authority about the requirement to report your immune status, but they've not been consistent, and they've been different in different health authorities, and we've not had the ability to rapidly look at across the province where we have areas that we need to address. So to understand these areas of vulnerability. And we're going to have an active program to offer the vaccines that people are missing, to make sure that they are protected for all of these concerning vaccine-preventable diseases. And as I mentioned, it allows for much more efficient public health response when we do have an exposure event, an outbreak, and all of that makes us better prepared for the next pandemic that sadly is probably inevitable at some point in time. So I believe this is the right balance of protection of healthcare workers, of our public healthcare system, and of the patients and residents that we serve. It builds on our provincial system that we developed during COVID-19, our immunization registry, and our system of being able to contact people and recall them back in for vaccines, and to make sure that we have those recorded in a provincial level way. And it makes sure that healthcare workers are protected and can get the vaccine or medications that may be needed after an exposure to prevent them from getting sick. So I think this is a very good step forward. It's something that we've been advocating for many years prior to this pandemic, But I think putting the effort in, I believe putting the effort into making sure we have that system in a provincial way, and that we are following up with people who need to have their additional doses of vaccines if they are required, puts us a step ahead and makes us prepared for whatever's coming next. So I'm going to stop with that. Thank you very much, and we're happy to take questions.
Thank you very much. A reminder to media on the line, please press *1 to enter the queue. You'll be limited to a question and a follow-up. We will start here in the room with Richard Zussman, Global News. Please go ahead, Richard.
For many people, philosophically, this mandate was a message that we were taking this as seriously as we possibly could. As recently as a few weeks ago, the Premier said we are not going to go backwards. In multiple press conferences and even in the legislature, Minister Dix said that he doesn't expect this to change. You repeatedly said you didn't expect this to change. I understand all of the science you have described here, but philosophically, are we not sending a message that we do not believe that mandating vaccines is the best possible way to send a message to the public that our healthcare workers, those dealing with the most vulnerable, are taking this the most seriously?
I just say first, Richard, that the basis of the vaccine mandate was the public health emergency. And just to put it in context, I think I know that you remember that, people in the public remember this, that we first got vaccines in December of 2020 in BC, a few, that most people were offered vaccinations, the double series, first double series, by the late summer of 2021, I should say. And then in 2021, we were also facing very significant issues because of the Delta variant with unvaccinated people. We had looked at this issue, so it wasn't possible before the summer of 2021 because we hadn't had the vaccines available to people to put a mandate in place. The decision was taken by provincial health order to put it in place, and I absolutely supported that decision. I've said so many times. It was a provincial health decision, and those who have argued that it shouldn't have been taken are really challenging that. But it was a provincial health decision in a pandemic that was absolutely the right decision. It wasn't the sole reason that we've led the country in recruiting healthcare workers. It wasn't the sole reason that we had the best record against COVID-19, but it demonstrated, as you say, our determination to take the action required to keep people protected. Those were the circumstances during the public health emergency. As the public health emergency ends, and the basis, the sort of legal basis and the public health emergency basis of that ends, a new decision has to be made. What's the path going forward, right? And the path going forward is to ensure across a range of diseases that we have as close to possible a system where everyone's vaccinated, a healthcare system where everyone's vaccinated to keep people protected. And that's similar to what the view we've taken, for example, in other areas of immunization. So that means the mandatory registry, so we know everyone, so we can respond to incidents as they occur, but also encourage people to get vaccinated, by offering vaccinations just as we did after the measles outbreak in 2019, when I think 38,000 young people who hadn't previously been vaccinated against measles got vaccinated, and we brought in a registration system at that time. BC, you'll know some other jurisdictions talked about taking the action we took in October 2021. I think only one other did at a provincial level, although many hospitals and other institutions across North America have taken those actions. But BC was unique in our determination to take that action. The question is, what's the best thing for people now? I think the best thing for people now is to take this action across a range of immunization areas to keep people protected. And so that's the action we're taking. The things that makes people safer aren't the rules, they're the vaccines, and to make them available as widely as possible, and to continue to build on the record we have in BC, especially of offering vaccines and of having a system that's easy to get vaccines. One of the reasons we did twice as well as Ontario last fall was we established during the pandemic a system, a vaccination system that really worked for people. So the short answer to the question is, yeah, we've done this throughout the pandemic. We've adapted to the circumstances. We've changed decisions when we thought the initial decisions were inaccurate or wrong. And for the most part, I think we got it right. The evidence is how we've done. And we're taking that approach in this case as well. Yeah, absolutely.
So there's a couple of things that I consider when we look at this. One is balance, and we've tried through the entire emergency that we were in to balance the measures that we put in place with the risk, and it's challenging. You can never get it exactly right. I believe, and I think the data shows that having that vaccine mandate in our healthcare system made a huge difference in protecting people and in confidence in our system, in our healthcare, in the public system that we work in. But, and I said this before in the pandemic, from an ethical principle, what we need to do is just enough. And it's very hard to figure out where just enough is. And when you're in the middle of an emergency with so much uncertainty, it may be different than when you're at this point where we are now, where there's so much higher level of protection. So I see this as the perfect opportunity, with the understanding of how important immunization has been in getting us through this worst crisis that we've ever faced, at least in our generation, around communicable disease, is an opportunity to focus on all of the vaccine preventable diseases that we know can have a horrendous disruptive effect and cause illness in our healthcare system. So I think the time is right to do that, and it is a bit of balancing, finding the right way to do that. We know that being required to report your immune status or your immunization status is one of the things that triggers people to get vaccines, to remind them, because it's an important thing that they have to do. And there are implications. Implications that if you're not immune and you've not been vaccinated, measles is a classic one, then you may be off work for an extended period of time, because the incubation period is quite long for measles. And so those are things that you have to think through. But I think we've seen that people in our healthcare system and in our province believe in immunizations. And I think this is the right level of a measure that we need to have in place now.
For Minister Dix, BC United and the Conservative Party of BC have continually made the argument that this mandate is one of the reasons for why we see hospitals close in northern parts of the province. How many healthcare workers do you believe will be back on the job as early as Monday? And what difference will that make in our crisis? And for old time's sake, can you tell me how many surgical masks we used yesterday in our healthcare system?
First of all, just to talk about that issue, in the year after the mandate came into place, Richard, we added 6.7% more registered nurses, and Alberta lost registered nurses. So the answer to health human resources issues is retaining healthcare workers, recruiting more, making this the best place in the world to be a nurse, and we've taken those actions with the BCNU, the best place in the world to be a family doctor. So as you know, we've led the country in doctors, led the country in nurses, led the country in health sciences professionals, and we also have, in the last 3 years, during this period of public health emergency, the largest increase in population the province has ever seen on MSP, 550,000 to MSP in 3 years. So we've seen dramatic increases in our population and demand on our healthcare system. So with respect to this, we will be going through a process. It's not going to be Monday or anything like that, but it will be available to people who chose not to be vaccinated against COVID-19 to return to vacant positions in the system, and that will happen over time. The number in categories, just to talk about the number of people, because the total number of people affected by the vaccine mandate was 2,692. The majority of those were casual workers, so only about 630 were full-time workers in that time. A very small subset of that. The highest vaccinated people in our system were doctors and nurses and health sciences professionals. So it's relatively few. I'll just give you an example, because people talk about emergency rooms. In the Northern Health Authority, there are 2 full-time nurses that lost work because of the vaccine mandate. 2. 1 part-time nurse in the Northern Health Authority and 4 casual nurses. In the Providence Health, there was 1 part-time nurse total. So I know that people want to, who are making their own case about vaccination, may want to raise these issues. The response is supporting the public healthcare system, investing in the public healthcare system, recruiting in the public healthcare system, having a health human resources plan that works. That's the response to those issues. And but this is a change in this measure that was put in place because of the public health emergency. And on balance, I think this is the right approach. And we try to, as Dr. Henry has suggested, be measured in our responses to these issues, and as we are in this, and as we have been to previous crises in the past.
Next question comes from Katie DeRosa, CBC. Go ahead, Katie.
To either Minister or Dr. Bonnie Henry, won't some health workers actually see this as an expansion of the mandate, because now there's this mandatory reporting requirement, and what will happen if they don't want to disclose?
Well, it's not an expansion of the mandate. The mandate was basically you had to be vaccinated against COVID-19, and a number of people chose not to be vaccinated, and they could no longer work in the healthcare system. So that requirement is not in place. You do not have to be vaccinated to come back to work. So that mandate is no longer in place. It was a mandate put in place, a requirement for immunization put in place under the provincial health emergency, and it is no longer in place. We have a registration system. As you know, we have one in public education. We talked about that as the response to the outbreak. There were 29 cases of measles in March of 2019. We put in place a registry and a program to increase levels of immunization at that time. So I think it's reasonable that if we're asking people, children who attend grade 4, their vaccination status, it might be reasonable that people who work in the ICU or in long-term care would do the same.
And what do you say to John Rustad, who tweeted that he thinks the election has pushed you to overturn this? And what do you say to healthcare workers working right now who actually support the mandate and do not want it to be lifted?
I say first of all to the latter group, because the former group, that's a discussion that people have. I think Mr. Rustad, who, we lived through this pandemic. We lost many people in our communities. People suffered real losses who didn't lose their life. We lost family members. I lost family members, right? I think the actions that were taken and the leadership by public health was exceptional in the pandemic. And that leadership by public health, that willingness to say at a time when people were seeking confidence, when something that had never happened in their lives before was happening, that we would make public health decisions and put them and support them with resources in the hands of public health leaders of talent and generosity such as Dr. Henry was the right decision. And I know Mr. Rustad feels it would be better if he decided.
Our next question.
Anyway, and I would say on that point, and to healthcare workers, I say that our determination to continue on vaccination, not just these, is demonstrated by the actions we've taken today, which reflects their view. 99% of healthcare workers got vaccinated against COVID-19. 99%. That's hundreds of thousands of people. More than 99%. In certain categories, such as doctors and nurses, it was more than that. And I honor that. And that reflects their view, and that reflects the view on this issue over time. This is a new time, and we have to deal with this new period after the public health emergency. And our determination to deal with these issues and to support public health care workers and those who work in contracted agencies and everyone else is not changed one whit.
Just to be very clear, it's my determination when the conditions are met for a public health emergency, and it is something that my team, some of whom are here today, where we look at the data on a regular basis, and it's always a discussion. When is the right time? It has nothing to do with any of the decisions of government or other factors in the health in that sense. So there is an obligation under the Public Health Act for me to lift orders as soon as reasonably possible when the conditions are no longer met. And it's a bit of a balancing act to find out when that is. It probably maybe could have been a few months ago. There is still some uncertainty about whether we were going to see a spring wave with some of the changes we are seeing in the US, but it really needs to be as soon as reasonably possible after I am confident that those conditions are no longer in place.
Our next question comes from Vaughn Palmer, Vancouver Sun. Go ahead, Vaughn.
Thank you both for doing this. Dr. Henry, I remember a day during the pandemic when you said that if healthcare workers didn't believe in the efficacy of vaccines, they should think about a different career. Is that still your view?
That has been my view for many, many years. I've been involved in immunization and for decades now. I served on NACI. I've been the chair of Immunize Canada. You know, immunization is one of the most important global public health measures that we have that have increased life expectancy, protected children, protected vulnerable people in our healthcare system. And we all know that if you're in a hospital, you don't have a choice of who is caring for you. You don't have a choice of who's coming in to do tests on you. You don't even have a choice in many places of who's in the room with you. So I absolutely believe that if you are going to be part of our public healthcare system, that we have a moral and ethical obligation to take those scientifically proven methods that protect us so that we can continue to go to work and protect those people that we care for. And I've been on record as saying that many times in the past, too.
I take it from what you said minutes ago that you made this decision without thinking about the political dynamic of the year. You've also said you're going to continue monitoring the situation. So if the conditions return and conditions change, are you saying you'd bring back the mandates even if we're in the middle of an election campaign?
Absolutely. If we are in a situation, and this is one of the things that makes it so tricky, if we had a major measles outbreak that affected different areas, so we may not need to have it for the entire province. We could have it in a specific area where people needed to be ensured that they were immune or vaccinated, so that we can protect people within that community. And we did that in 2014 when we had the large measles, or 2011 when we had the large measles outbreak. If we see a major change in the SARS-CoV-2 virus that causes more severe illness, breakthrough in people who have protection now from vaccines and from previous infections, then yeah, we would need to put in place additional measures again, requiring vaccination. We may require updated COVID vaccines if the situation changes. And, you know, that's part of the role that we play. We have a very strong team behind us, particularly the BC CDC and our public health laboratory, where we can look at this data over time and the connections that we have globally so we can tell what the situation is.
Next question from the room is Anna McMillan, CTV Vancouver Island.
Hi there. I'm wondering if this has any significance for people who lost their jobs because they weren't vaccinated, or for employers who don't want to hire people who are not vaccinated.
Well, I think it has significance in that currently, for a whole series of jobs, until the change today, the end of the public health emergency, people were not able to be hired in such jobs, and now they are. And so what will happen, and there's obviously detailed discussions that have taken place when this happened and will take place because this is a largely unionized sector, but if positions are vacant and people are qualified for those positions, they will be able to get hired in those positions. And that's what will happen throughout the public healthcare system. So that's our expectation of what will happen now, and that is the correct and proper consequence of the action we took today.
So this is the public health care system that we're talking about. There are some private organizations that may have employment requirements, including vaccination, and that's certainly up to them. But what we're doing is this is the standard for our public health care system and for health authority contracted facilities as well.
That's right. So if you're talking about a long-term care home, obviously the registry, for example, applies in that case. We never applied this specific rule to say in the same way to, I don't know, chiropractor's office. It wasn't applied in the same way, so it doesn't apply there. But to those contracted facilities in long-term care, for example, it certainly applies.
Follow up, Anna?
Yeah, a question from a colleague for Dr. Henry. You addressed the air quality off the top. We can smell it in Victoria, probably across the province. Can you just share some messaging around that?
Right. So I know I certainly tasted it when I went for my run this morning, and it is one of those things. It can be very irritating, particularly people who have underlying health issues like asthma or lung disease. So when you have smoke in the air like this, it's important to understand your risk and to take measures to stay out of the smoky air as much as possible. So having a place in your home where you have cleaner air, there's lots of good information on the BC CDC website about things you can do to protect yourself. Not going out and exercising in the heavy smoke, for example, finding places indoors where there's cleaner air. Those are things that we've been having to live with over the last few summers. And sadly, we will continue to have to pay attention to those.
And we go to the phones now. We hear from Mike Hager, Globe and Mail. Go ahead, Mike.
Hi there. Thanks for taking our calls. Can you tell me how many people are estimated to be suffering from long COVID today, and what is the provincial response? Are there any physical clinics left, or is it all virtual care now?
Yeah, so we don't actually have a number either in BC or globally about long COVID. There's still a lot that we are learning about post-COVID syndrome, how long it lasts, who's more likely to be affected. There's lots of good information that's started to come out, particularly there's a global network study that's coming out of Europe and one in the US as well. We continue to have the network clinics here in British Columbia that are doing some really important work around supporting people with post-COVID syndrome. And so we're getting a sense that it's probably in the 3 to 5%. But again, there's no global agreement yet on case definitions. So it varies quite a bit. I will put in a plug that we know that people who are vaccinated, even after their first infections, that vaccine does make a difference in helping people recover from long COVID. That's and also preventing them from getting long COVID symptoms in the first place. So the virtual network is still very active. It's supporting people who have a primary care physician and is also doing a number of research projects across the province.
Follow up, Mike?
Thanks. For Minister Dix, so the end of the public health emergency, where do any legal challenges against the vaccination mandate for healthcare workers stand? And then, Dr. Henry, you said masks are appropriate when needed. When do you advise the public to still put on a mask?
Well, just on the primary legal challenge, there was a decision in the BC Supreme Court around that, supporting. There was some exceptions. People had worked virtually, but basically supporting Dr. Henry's action, and her actions have been repeatedly supported in the courts. On the second point, I'll leave it to Dr. Henry.
Sure. There are still some ongoing legal actions that we're involved in. So far, all of the ones that have been heard have found in favor of the work that we've done, though we continue to work along with our legal support services on that. In terms of masking, we know that there's some conditions where people are not sure. They have a bit of a scratchy throat. They need to be out somewhere to pick up something or to go places, and wearing a mask can be appropriate. Wearing a mask can be appropriate, as we know, to support people through some of these smoky skies if they have to be outside. So there are times when masking is helpful in terms of keeping your secretions away from others. And for people who are more vulnerable, if they need to for example, get healthcare services in a place where they're sitting in a room with others. Wearing a well-fitting N95 mask and respirator can give you protection, extra protection. So I think many people who are immune compromised are continuing to wear respirators when they're in healthcare settings particularly, or in settings where there may be around people that they don't know. As I said, COVID is still here. We know that there are other respiratory infections. Pertussis is increasing a bit. We expect that we will see the rise again of influenza, RSV, and likely SARS-CoV-2 as we go into the fall.
And we have time for one more question today. We'll go to the Interior. Ian Burns, Now Media. Go ahead.
Hi there. Thank you. I was just wondering if you could speak in languages as simple as possible and explain why exactly it is that British Columbia ended up being something of an outlier in Canada and really in the world.
An outlier in the sense that we were the most successful jurisdiction in dealing with COVID-19. Happy to be that outlier. Best record on vaccination, best record in long-term care, because our teams worked together so diligently, Dr. Henry's teams, but also long-term care providers and unions. There was a central commitment to people in BC. We were an outlier in getting children back to school in classrooms sooner than most other jurisdictions in North America or in Europe. We did that, and we've seen in studies since that the benefit of that, but that required extraordinary effort by parents and by teachers and by teaching assistants and administrators and the students themselves to make that happen. An outlier in terms of our comprehensive public response, our ability to respond when there was a crisis in the north, to bring patients down, because we put in place a network of air ambulance service that facilitated that, and the extraordinary work of our ambulance system. An outlier, yes, in terms of putting in a vaccine mandate requirement, but other jurisdictions, other hospitals and other jurisdictions in Canada did that, but there were essentially two that did it, ourselves and in Nova Scotia. And we did that because we were determined to keep people safe. And an outlier, maybe, because of our determination to support public health and to put the health of British Columbians first. And I know they did that in lots of places around the world, and everyone did that in lots of places around the world. But we had exceptional public health leadership. So an outlier in those senses, yes, in terms of our response, in terms of our outcomes, in terms of our communities coming together, in terms of our supports for people, in terms of our supports for businesses, in terms of our support in education, in terms of our results, our commitment to long-term care. And still, there were enormous losses and small losses that carry on and have huge meaning to people, including many, many people who lost their lives, who were vulnerable, and who lost their lives to COVID-19. And others who suffered from it in our province. So I'm very proud of our record. We did chart our own path. We worked with other jurisdictions and the federal government and all of those programs. We worked with other jurisdictions and worked on the best information around the world. But we did take action to ensure that people were protected in BC, action to support public health, action to ensure that it was scientific decisions that were made and not other decisions. And I think the results compared to other jurisdictions were excellent, but I would say that the losses were still profound and will be with us as long as those of us who lived through it live.
Follow up, Ian?
Thank you. I did mean retaining the vaccine mandate when other people dropped it. But I also want to ask you, is there anything that you would like to say to the health workers that were fired? Would you like to make an appeal to them to come back? Is maybe people who are in two minds, maybe they've gone to Alberta. Are you actually going to try and entice them to return?
Well, a couple of points I'd make. The vaccine mandate was put in place in 2021. I should say the period from 2020 to 2022, we added 3,055 registered nurses in BC, and they lost 300 registered nurses in Alberta. Healthcare workers have been coming to BC, partly because of the actions we've taken with family doctors and with nurses and others. This is our determination to make this the best place to practice in our province. What we've tried to do, and what I've tried to do, and what I think the government has tried to do, and I think that it has been heard in the public, is not to divide people. I respect the decisions people make. I respect the decisions people took, and in some cases led to them leaving their jobs in the public healthcare system. I respect that. I respect people's agencies to make decisions about their own lives. And you haven't heard us be critical of people in those circumstances. Quite the contrary. Our determination has been to provide more care. And the people who've benefited most from the great levels of vaccination in the population, you could argue, are people who are themselves unvaccinated. But in any event, we need to work with everyone, vaccinated and unvaccinated, and bring people together. And I think that's what we did in BC in these times. We want everyone who can work in the public healthcare system to be able to work there. We have a health human resources plan that's adding positions, adding spaces. We have enormous challenges in mental health and addictions care, for example, and in care across the province as we deal with a growing population. We've set records in all the areas of health delivery, and we face extraordinary challenges. And so we need everyone. We encourage everyone who can work in the healthcare system to work in the healthcare system.
Thank you very much. That concludes today's availability.
Thank you.